Now to a Target 12 investigators exclusive, fewer pharmacies.
The number of pharmacies in Rhode Island are on the decline, and independently owned pharmacies are struggling to survive amid pressures in how drugs are priced and from large drugstore chains. Target 12 investigators Tim White and Eli Sherman explain what it means to consumers.
We mapped every retail pharmacy in the state, and it's no surprise that the majority of them are clustered in higher population centers. But you can see the numbers dwindle in the more suburban and rural areas of the state. And recently, the last remaining pharmacy in Jamestown closed, leaving residents there having to go over a bridge if they need to go to a pharmacy. In 1977, Baker's Pharmacy in Jamestown opened its doors.
We became really close with people that lived in Jamestown.
Owner Tim Baker says they would get calls in the middle of the night to fill an emergency prescription and became part of the fabric of the seaside community until 2019.
Was it a difficult choice to close?
It was very difficult, really. I mean, I go to the local grocery store and I hear about how much we're missed, how sad they all are that we're not here anymore.
As an independent pharmacy, Baker says the business model became unsustainable.
The landscape for an independent pharmacy had eroded to the point where we were not making any money filling prescriptions. No matter how many prescriptions we filled, we were actually losing money.
Baker's Pharmacy wasn't alone. A Target 12 review of pharmacy licensing data shows Rhode Island has the lowest percentage of independent pharmacies in the country, second only to New Hampshire. And overall, the number of pharmacies have been on the decline, down 11% in the last 5 years, from 198 in 2019 to 176 today. There are several factors as to why there are fewer pharmacies. So-called pharmacy benefit managers owned by massive healthcare conglomerates like CVS and act as middlemen by setting prescription drug prices have been particularly hard on independent pharmacies.
I'd probably be a little bit naive. I probably wasn't aware that the other pharmacies were closing. I mean, I opened it because I felt like there was a need in the community. Hey, ¿cómo te vaya? ¿Cómo te está haciendo?
As Baker's in Jamestown was closing, Dr. Eugenio Fernandez was opening as Thenis, an independent pharmacy in the west end of Providence.
Spiral on an axis.
Along with filling prescriptions, Fernandez says they offer other services for those who have limited access to health care.
Help someone manage their diabetes, help someone manage their high blood pressure, help someone prevent illness by getting their vaccines and telling them which vaccines are due.
Fernandez says offering expanded services is important, especially in lower income areas, but is also critical for an independent pharmacy's business model.
We have to do all these other things. One, it's good for the community, it's good for the people, and two, it's just what is sustainable in terms of having an independent pharmacy or a public health entity that we want to fill a void in the community for.
Fernandez is optimistic that independent pharmacies can still play an important role in communities, but acknowledges they are feeling the strain from bigger chains and the pharmacy benefit managers that set drug prices for the vast majority of people who walk through his stores.
You're in the pharmacy industry and more. Is it a broken model?
I think that the United States of America is the best country in the world, but our health system isn't. And I think that there is opportunity to make it better for sure and make it a better experience for everybody. And muchas gracias. Hopefully for us, if we can do a good job and do well, then it can be something that we can replicate in other communities as well.
Coming up, new at 6, we take a closer look at the system that sets the cost of prescription drugs for most Americans and why it has come under fire. With the Target 12 investigators, Tim White, 12 News.
New details now in our Target 12 investigators exclusive, fewer pharmacies.
As we reported on 12 News at 5, there has been an 11% drop in the number of pharmacies in Rhode Island over the last 5 years. And research by the Associated Press shows Rhode Island has among the fewest number of independent pharmacies per capita in the country. New at 6, we look at what some experts say is a prime reason why.
Target 12 investigator Tim White is here now with the exclusive details. Tim?
Chances are you use what's called a pharmacy benefit manager, or PBM, when you get your prescription medication. Critics say those PBMs have put the squeeze on independent pharmacies. Tim Baker opened Baker's Pharmacy in 1977, but instead of handing the business to his son 4 decades later, he chose to close in 2019.
No matter how many prescriptions we filled, We were actually losing money.
Now Jamestown residents have to go over a bridge to get to a pharmacy. Baker says pharmacy benefit managers, or PBMs, played a role in his decision.
They set the reimbursement, whether it costs us that or less or more. We had no choice but accept what they paid us if we accepted their pharmacy benefit people that were in their programs.
And the vast majority of Americans are leaving independent pharmacies with little choice but to agree to PBM's reimbursement rates. The biggest names are CVS Caremark, Optum Rx, and Express Scripts. The Federal Trade Commission has accused PBMs of prioritizing profits over patients, and they have recently come under fire by members of Congress.
For one reason: they can pad their profits.
But PBMs argue they've saved patients billions by negotiating with pharmaceutical companies. A spokesperson for the Pharmaceutical Care Management Association, a trade group for PBMs, said in an email, there are many factors for pharmacy closures. However, pharmacy benefit managers are supporting community pharmacies in rural areas through programs that increase reimbursements. Blaming PBMs for pharmacy closures is not based on the facts.
I'm very comfortable saying we're here, and we're here to stay.
At around the same time Baker's in Jamestown was closing, Dr. Eugenio Fernandez was opening Athena's in the west end of Providence. He says independent pharmacies like his play a critical role, especially in lower income communities where people often have limited access to health care. Fernandez says he offers more services than just filling prescriptions that can offset the financial pinch small pharmacies are feeling.
So sustainability is our key thing. It's the reason why, Tim, why we do vaccines, why we do all these other things. We have to do all these other things.
An effort by independent pharmacies to stabilize drug prices failed in the Rhode Island General Assembly this past legislative session. Separately, a spokesperson for CVS Caremark said, in part, we stand by our record of protecting American businesses, unions, and patients from rising prescription drug prices. With the Target 12 investigators, Tim White, 12 News.